Hi, my name is Sundeep Punamiya. I'm a senior interventional radiologist at Tan Tock Seng Hospital, Singapore.
Hey everyone, my name's Satya Morar. I'm a medical student at Case Western Reserve University School of Medicine in Cleveland, Ohio, USA. It's about 10 p.m. right now. I actually just got back from the Cleveland airport after about a 40-hour trip, and that's because today we got something special. I'm going to show you the day in the life of an IR in Singapore. So I had the opportunity to sit down with Dr. Sundeep Punamiya over at Tan Tock Seng Hospital in Singapore. It's one of their state hospitals. And he's going to talk a little bit about what it's like to practice in Singapore versus some other countries, and a little bit about his journey practicing in multiple countries and moving around the world. We also have some interesting cases to go through, so I think it should be a good one. If you like this video, you should definitely check out the rest of the day in the life videos put on by the Society of Interventional Radiology. And if you're a student or trainee interested in IR, then definitely check out the Society, become a member. It's a really great opportunity to meet people from all over the world, like I did with Dr. Punamiya over in Singapore. So with that, let's get to it.
Hi, my name is Sundeep. I'm an interventional radiologist practicing in Singapore for the past 16 years. In fact, I moved here from a fairly busy practice in India. So I've been doing IR for almost 30 years, and it's very interesting because when I took up IR at that time, it was in its infancy, and especially so in a country like India, where everybody was just doing diagnostic radiology. We had just a smattering few doing IR. It was actually during my training, during residency, I just realized that there was a kind of a gap I felt, that we were not directly involved in patient care, and we were just always on the, behind the scenes in just diagnosing a disease, and then the clinician would just take over. And when I saw some procedures in IR, it sort of opened my eyes, and I thought this is really a fabulous field to pursue. It has grown over these years. I think in the early days we had very little equipment, and I'm sure you would read it in your books, but very little equipment to work with, and very limited technology as such. And it's expanded to a point right now that it seems limitless, and we can probably treat every disease that is written in the textbook in this day and age.
So what's your educational background? Where did you go to medical school? Where did you do your IR training?
Yeah, so I did my entire education in India. So did my med school training in India, and thereafter did my residency as well in another institute in Mumbai. It was called Bombay at that time. Thereafter, during this period, actually saw one interventional procedure that caught my eye, and that's the time when this patient with subclavian steal syndrome, patient having repeated attacks of fainting whenever they used to use the right arm vigorously. And I just went in to watch this procedure, and I saw the interventional radiologist, the attending there, very expertly he guided catheters right through from the groin. I could visualize it going up the body into the subclavian artery. Then he used a balloon, he dilated it, and I was just keeping my hand on his patient's right wrist, and I was just fascinated. The moment he deflated the balloon, I suddenly found a bounding pulse. Next day I saw the patient, and he was actually moving his hand. He was exercising with a dumbbell there, and he said there was absolutely no problem. I thought, this is the field I want to do. And so therefore I actually approached this interventional radiologist, my mentor at that time, and I asked him whether I can train with him, and luckily he agreed, and I spent a year with him, and thereafter it just kept going on from there.
what do you love about IR, and what are your favorite parts of practice? Do you have a favorite case?
Yeah, so if you any area of interest, I would say would probably be hepatobiliary and GI interventions and embolization in general. I think for me, hepatobiliary is one area I just love. I feel the liver is one of the most fascinating organs in the body, and there's so many disorders of the liver that you can treat with IR. It's just amazing. If you look at the procedure that really would be my favorite case, it's a hard one. You really can't pinpoint one case, but the one that comes to mind is probably the one I did as in my early days as attending. And the reason I say that because it brought to the forefront a few things which IR is so special about, and that's basically skill, innovation, and also having to keep up with modern literature. So this patient actually was a patient with aortoarthritis, had a very tight renal artery stenosis, and was having severe uncontrolled hypertension as a result of that. I mean, those days we would just go ahead and do a balloon angioplasty, and we did that. Did a high pressure balloon angioplasty because aortoarthritis artery doesn't really dilate that well. And when we did that, I got a sudden rupture of the renal artery. I think now we would not be really that concerned because we would have a stent graft in place. But in those days, we didn't have any stent grafts. In fact, the ones that we had were either the wrong size or wrong for that territory. So what we did was we took a stent, and we had a surgeon nearby who, in fact, did not want to operate on the patient. So he managed to take out a bit of the saphenous vein, a small piece of that, which we sutured onto the stent, and then got that stent through that area of the renal artery and deployed it there. And we managed to control the bleed, just with simple innovation. And because I read about it probably a few weeks back that this was done in another region of the body, just struck that why don't we try this, and it worked. And I keep showing this case to all these workshops and lectures that I do, especially in countries that are less developed, that you can still perform procedures even if you don't have all these expensive toys available.
So you mentioned that you did your education in India and then came to Singapore. How did you decide that you wanted to move to Singapore, and why didn't you want to stay in India or perhaps move to some other place in the world like the US or Europe?
Yeah, that's a toughie actually. I mean, my practice in India was busy, and my move, in fact, I was planning to relocate to the United States actually, and more from the personal and professional standpoint. Singapore came in as a kind of a transit for me, and I thought I'll try it out for a few years. And during that course, I would complete all the credentialing criteria that are needed for the US. But I stayed here for probably within a year, and this place just grew on me. I think it's Singapore as a city itself is just fabulous. It's small, but it's very clean. Law and order is stupendous. It's a fabulous place for children to grow. The schooling is high class. The healthcare itself is high class. The people I worked with were fabulous. This is so multicultural, so diverse. It was so easy to assimilate within the population here. And as I said, the connectivity, it was so close to other parts of Asia, specifically for me coming from India. If I had to keep going back and forth, it was just a 5-hour flight, which would have been a lot different if I had been to Europe or the United States. Yeah.
So I know that you have experience with the Society of Interventional Radiology. With your experience with SIR, what do you think are big differences between how IR is practiced in the US or Europe and then places like Singapore? Is there a difference in procedures, or how are the people? What is your opinion on that?
I would say probably if you look at not just Singapore, let's say Asia in its completeness. Asia is very diverse, and that's because of different socioeconomic strata, difference in cultural beliefs. It's a lot different. You'll find places where they cannot even afford an angiogram versus places like here where you can easily get an aortic stent graft without blinking an eyelid. So It is diverse in Asia. Now, Singapore in particular, if you look at it compared to US, I don't think it's much different in the repertoire of procedures that we perform. We probably perform the same thing that any center in the US does. Majority of our cases are still the basic stuff of drains and lines, but we do anything and everything ranging from a simple angioplasty, embolization, complex tips, a fenestrated EVAR, the work. So we're doing everything. But we do have a small population. It's probably close to 5 to 6 million, and we're just treating that much compared to the US, which is 300 plus million. So I guess that's where the difference probably lies. We do use the equipment that's available here is world class. It's this, even in the public hospitals, you'll find that the equipment are absolutely a very high standard, which you would probably not even get in some developed countries as well. So and we have devices that are available probably even earlier than you get in the US, because once they're CE marked, it is possible to get them into Singapore. So we do have the ability to treat various things here.
What does your daily schedule look like as an IR in Singapore?
So I think our practice is, I'm in a public hospital here, and we typically start work around, in the radiology department, around 8ish. Being a public institute involved in academic work, so most of us attendings would have a combination of clinical work, academic work, that is teaching and training, and also some bit of administrative duties. I think it's no different in other centers. So I would typically come in at about 8ish. Our first patient rolls in about 8:30. So before that, we'd have one quick academic session going on usually with the juniors. We start our cases. We have multiple rooms running, and they were involved in either doing the cases, supervising the cases, mentoring the juniors. And in between cases, it's usually seeing consults. The clinical team comes down for opinions. We provide those opinions, and sometimes spent in just training the juniors on how we would probably deal with cases, especially the ones that are done last night during on-call period. We finish work usually about 5ish, 6ish. Yeah, I think our practice is pretty good that way. We finish right on time, and thereafter head home back to the family.
What about your call schedule and vacation schedule?
So we are a big team now. We started off with a very small team. So it started off as a 1 in 2 calls. As now, like, we do probably 3 or 4 calls in a month maybe. Calls are not extremely busy. We don't get the volume of trauma that you would probably get in some parts of the world. But I think it's quite manageable because it's not extremely heavy.
What advice would you give to a pre-medical or medical student who is perhaps interested in pursuing IR, but also might want to practice in a different country one day?
Okay, so I think when you are planning to relocate to another country, I think you have to look at various things very carefully. There are various factors that you look at. One is you need to really research the country properly. It's especially with its rules, regulations, especially the medical bodies that are there, whether you have the requisite degrees and the training to work there in the first place. Every hospital will have a particular volume of cases, a particular type of cases. So when you're going there, just make sure that is on par with your expectations, that this is what you'd like to learn or you'd like to do. And also if your branch that you're willing to pursue is well established there, or at least has the potential to establish itself fairly quickly. Now, one important thing when you're relocating to another country is actually the language and the socioeconomic barriers and the cultural barriers that you have to overcome. So coming to Singapore is not a problem because most of the people here do speak English. But when you go to other countries where English is not the primary form of communication, it's important to learn the language. IR specifically, and of course, as with most of medicine, there is more direct patient contact. And if you do not have that rapport, you do not develop with the patient, you can be at a disadvantage when you treat the patients. Understanding also the rules and regulations from the legal standpoint. So if there is ever a mishap and you are faced with a lawsuit, then you should know that you are well covered, and it's a fair system to judge you there. As regarding the other things, you should also look at from the family standpoint, that is it a good country for you to move there? Look at how safe it is for you and your family, the education system, the opportunities for you and your spouse to not just do work but also do any other extracurricular activities. The working hours are also, and of course the pay scale, taxations, all these things have to be factored in when making this decision. Yeah. Yeah, as regarding coming to Singapore for, say, for training purposes or even working here, there are certain criteria that you have to fulfill, and that starts with typically with your training and your what degrees and certification you have obtained. If you are, say, an American board trained radiologist, or having worked in UK, having done the Royal College training, UK, Canada, in Australia, it makes it a lot easier to get in here, because that is one of the basic qualifications they need. Coming into work in Singapore, I guess it's, if you had reasonable experience with the American board, it really shouldn't be a problem coming here. I think it all depends on the demand supply. If they are looking for people, and it's going to happen, we are getting more and more hospitals coming, and I'm sure they would love to get some expertise from overseas. And if they are able to do that even for a short period, I think you could certainly look it up. You can just connect with the different hospitals that are here and send them an email and see if they're open to it. Yeah.
What advice would you give to a medical student trying to determine which training program they want to attend?
So when you're looking at a training program, I think you need to kind of get exposure to the various fields that are available. So, radiology has now become huge. It's not just plain X-rays anymore. So you have to get exposure to each one and see which one really appeals to you the most, and the one that you're most passionate about. You have to also understand that field very well, exactly what it entails. Because as a diagnostic radiologist, your responsibilities with the patient are a lot different than to be, say, with an interventional field or surgical field for that matter. So do understand what is needed from you, and see if you think you'll be able to meet those standards in the first place. Then if you're intending to train or work in a field that needs good operator skills, say like surgery, interventional radiology or interventional cardiology, it's important to just gain a bit of hands-on experience. And that's important to know, because you can learn how your dexterity is, whether you really have some good hand-eye contact, hand-eye coordination for procedures, whether you have the temperament to withstand the stresses of procedures, and especially when they have bad outcomes. So these are probably a few things that you look at. When you look at the program, then if you look at the volume of work, it's good to go in a place that has reasonable volume. But even if it doesn't have a very high volume of work, it should be high quality work. So you should be doing the right thing. You should be able to work with equipment that is on the forefront of I would say, cutting edge tools should be available, so you get an idea of what the future is about, and you'd have a head start on using them. Most importantly, the program should have a good mentor, and the faculty, the senior staff should be really nice, and good teachers should be willing to spend time with you and teach you. So I would say probably the best thing to do is find out from people who have been in the program in the past, speak with them, get first-hand information of the pros and cons of that place before you make that decision.
In terms of your practice here in Singapore, what does it look like for new procedures to be implemented? So things like prostate artery embolization or genicular artery embolization that are a lot newer and on the scene now.
So it's not that difficult getting the procedures in. It's just a question of getting the patients in. I think that's largely because we still don't control the patients. There'll always be a bit of a pushback from clinicians when they have a new procedure, and especially if it is it's competing with the one that they are doing. But certainly we don't have a major issue there. What we do is if we have to implement something, we engage them, and they're very friendly, most of them, and most of them are communicating with us, and we discuss cases. If there's something, especially those which are high risk, are the ones they would probably offer us the first go at, and so we start off with that interaction with the clinicians. If we need any specific training needed for a procedure that is not an extension of the usual ones that we do, then there would be someone from the team who would have attended a course on this, or would have, as part of his clinical training in Singapore, had gone overseas for a few months, and as part of the training had actually learned that procedure and come back. So it is definitely feasible to do it. We just have to make sure that we also get the equipment. And as I said, we are lucky. We have almost all the tools available here. So I don't think that's an issue. If ever we need special expertise, someone to actually guide us, mentor us, and we can get a proctor coming in, that's not a big problem. We just get permission, they come and they help us out for this, yeah. Yeah, so we saw this case, which was very interesting. This patient had a long occlusion of the femoral artery, actually came in with claudication, and had an ulcer over the shin, and it was non-healing, and they had done a duplex Doppler, and that's what we generally do when we are examining our patients with peripheral artery disease. And that showed there was a long occlusion of the superficial femoral artery right from its ostium, right flush with from its origin, and going all the way down to the fem-pop junction. So you could say virtually the entire SFA was occluded, but incredibly had a very good runoff in the leg. So it had a triple vessel runoff, which is all intact. And that's a bit unusual in our setting. We get a lot of diabetic feet here which have a combined disease. In fact, more often it's just infrapopliteal. So what we did was, as we generally do, we get them on table, we scrub the groin, and we usually go antegrade. We don't go over and above. And that's essentially because it's easier, it's shorter devices, it's much easier to get the pushability when you have to cross through occlusal disease. So we managed to get a wire, and we found the ostium with some difficulty, and we obviously couldn't thread a wire through very easily. It formed a bit of a loop, and we decided, okay, let's do a subintimal angioplasty, because it works as well, especially in critical limb ischemia. That subintimal, the wire went subintimally, the loop went all the way down to the level occlusion, and we tried for a bit, but we just couldn't get it back into the popliteal. Of course, then the thought was, why don't we use a re-entry device? It's easy, but it's a bit more expensive, and certainly we look at it, we try to make healthcare affordable as much as possible. So what we did was, we just had one of my colleagues come in, and then he punctured the artery at the ankle, that's the posterior tibial, and just got a wire up. And once he got the wire up, and he couldn't get it out through the occlusion, but we both managed to meet at a particular point where it was common, and that was in one of the small branches of the SFA, and we managed to snare that wire out from there and just got a through and through access. After which we did an angioplasty. Now luckily we have these long balloons available, just one single balloon, long length, it was about 22 centimeters long, inflated a couple of times, great result, barring for one area of residual narrowing. So we did what you call a spot stenting there. And after that was fabulous. You got pulse in both the tibial arteries. This was just done yesterday, so I don't know the outcome, but I'm pretty sure that leg would heal well. Yeah.
Do you conduct any research at your center and in your practice? And how does that process differ here in Singapore versus maybe in other countries?
So Singapore is, if you may have read, is actually one of the foremost countries in research. In fact, they are leading in research, especially in Asia. So research is not new to us, and we have been conducting trials, and there are trials in foot also. We know how to do it. We have excellent regulatory boards who actually oversee the procedure right from its beginning to its from inception all the way till it's finished, and making sure that we've not wavered from essential practice of good research. And we have the ethics board, of course, in place. If I really can't compare it with many other countries, but certainly I think it's on par with the ones that are being done in US and in North America in particular.
Besides like practicing clinically, what are some other differences that you think people should be aware of in terms of practicing in Singapore or in other nations versus places like the US or Europe?
So I think when you're practicing in a different country, it's a few factors that you have to keep in mind is overcoming these few barriers of language, the socioeconomic differences. Like some patients, some countries, procedures are kind of unaffordable, and then you have to innovate in a way to provide to make it either affordable or doing a procedure that is similar, but not as expensive as what you would be providing. Important that some places they have cultural barriers in accepting some procedures, so that's something you have to keep in mind. It's just that you have to bear in mind about these things with your patients. This is with your colleagues. I think it's a lot easier as long as you're able to communicate with them. Probably I would say anyone who's practicing medicine, there are the A's that we say. You should have the ability, you should have the affability, availability, affordability, and especially for those who are coming to another country, I would add adaptability, and that's probably the key when you're practicing in another country.
So obviously you're a member of SIR and many other societies. What are the benefits of being part of these kind of professional organizations worldwide? Why do you think students should get involved in them? And why did you get involved in them? What is the benefit then?
So I've been a member of SIR since over 20 years now, and it's been a tremendous experience. So I got in initially as a young attending. That's the time I joined SIR, and now being a senior member, I still see its value. If you are a resident or fellow, it is even more useful because you're able to network in such places for jobs, for placements, for training opportunities. SIR provides excellent educational resources for you to go through both online as well as offline. They encourage juniors, even students, to take up leadership roles and be part of the group that are doing a part of these groups that are setting up different policies. You have access to all the standards of practice, the guidance. Standards of practice and guidance for practicing IR, and importantly, I think is you're able to attend meetings, and that attendance is so important because you're rubbing shoulder to shoulder with the absolute stalwarts of IR there. You're able to discuss with them, you're able to talk to them. Most of them, believe me, are so helpful. They're able to guide you, and the guidance doesn't stop at the meetings. What you have their contact details, just send them a picture of some case, and surely they'll be able to help you out. In fact, SIR has a social platform on which you can actually discuss cases and issues that you face. If you're working in say the US, it actually keeps you up to date with the policy, especially the government policies that are coming out regarding procedures, regarding reimbursement patterns, everything. So it keeps you up to date, and it helps you a lot in your learning process.
Thank you so much for your time.
Thank you.